Carpal tunnel syndrome is a common affliction that arises in many cases due to repeated motion of the hand and wrist. The median nerve becomes compressed. It's the main nerve responsible for sensations and impulses being sent to the hand and fingers.
And there's a ligament that goes over that nerve. And essentially what happens is you have a closed space, an O. And the surgery is to release the ligament on the ulnar side, the small finger side, and that becomes a U rather than a closed O, so it takes the pressure off the nerve.
Dr. John Rayhack is considered to be one of the top wrist and hand surgeons in the world. He received his training at the Mayo Clinic and has been repeatedly named to the list of best doctor in America. He will be performing the surgery that will finally bring me some relief after more than 10 years of dealing with my carpal tunnel issues.
When it comes to hand specialists, Dr. John Rayhack is, well, a rock star. Look at all these awards and accolades. He even holds a number of U.S. patents. I guess you could say for sure, my hands are in good hands.
The procedure takes about 45 minutes and will be done at the same-day surgery center at Tampa, Florida's St. Joseph's Hospital.
So we're basically going to go through the pre-op planning, where we basically say you are who you are, and we'll basically go over the operation, read the consent. We'll wash your hand, squeeze the blood up towards your arm, put the tourniquet on, put the local anesthetic in both locations. You can get sedation. As I said before, you can just decide how much you want to get.
After being prepped and getting a full briefing on what to expect, I get a kiss from my wife Nancy, and I'm off to the OR. I choose the option of going with just a local anesthetic. After all, I am doing a television story here. There really is no pain involved. The worst part is the tourniquet used to stop the blood flow to the hand while the doctor does his job.
Very unusual sensation to feel the pressure and the tugging and have a room full of people, and I'm wide awake.
In the meantime, while I'm under the knife, my wife is able to follow my progress in the waiting area.
They have this great monitor here where I know exactly where Dave's at. I have a personal ID number for him, and then I'm able to look at that and tell whether he's in surgery or if he's out in the recovery.
In my case, the surgery took a bit longer than usual because of a second procedure called a trigger thumb release. It adds an additional 20 minutes or so to the operation. The 8 or so stitches come out in about 2 weeks. Just 2 months earlier, I had my right hand done, and now they're both as good as new.
Big question. Will I ever be able to play the piano?
I've heard that 100 times.
It works.